You should be able to see a slide deck. Please let me know if there's any technical issues. We'll be sure to fix those. But without further ado, hello everyone. I'm Natalia Lapinskaya. I'm a Senior Program Associate at Patient-Centered Outcomes Research Institute, also known as PCORI, and today I'm here to talk to you about applying for PCORI funding. We always welcome high-quality applications, so we're hoping that this will be a mutually beneficial endeavor. A brief overview of what we're going to talk about today. First and foremost, what PCORI is, who we are, our research focus, what we do and what we do not fund. Then we'll move on to the actual process of application and application review, and finish off with some links and resources and time for Q&A. Now, as Erin mentioned, I do mean to pause for questions every so often. I unfortunately can't see the participants, so if you have a question, raise your hand or get in touch with Erin in some way, and Erin will alert me if you have questions throughout the presentation. But as I said, I will pause after each one of these sections to give you an opportunity to ask questions then. All right, first and foremost, who we are and what do we do? PCORI, Patient-Centered Outcomes Research Institute, is an independent research institute authorized by Congress in 2010 and governed by a board of governors representing the entire healthcare community. It is worth noting that we are not a government organization. Sometimes that matters when applying for funding, so we are not a government organization in the same way NIH would be. We are a funder, not a sponsor, meaning we fund research, but we do not involve ourselves in the conduct or the design or outcome selection. You do all that. We fund comparative clinical effectiveness research, CER, and we place a lot of emphasis on patient engagement. We seek to answer questions about what works best for patients based on their circumstances or concerns. That is, questions such as what you see up there on the screen. Given my personal characteristics, conditions, and preferences, what should I expect will happen to me? What are my options? What can I do to improve my outcomes? How can clinicians and the care delivery system work best for me? While we expect our research to be important to patients, we also expect it to be important to the broader stakeholder community, including caregivers, payers, health systems, policymakers, and others as applicable. In brief, this is a snapshot of our current funding commitment. As you can see up there, the bulk of it goes to CER, comparative clinical effectiveness research, with some methodological and infrastructure work in there as well. We fund research into a number of high prevalence, high burden conditions listed up there, cancer, cardiovascular, neurological disorders. And we emphasize populations historically underrepresented in clinical research. Our current funding commitment is about $3.5 billion, and we have a portfolio of close to 2,000 funded projects. Now, this is not to say that our funding is limited to those conditions or those populations. This is just something that we have chosen to emphasize. Applications in other areas studying other populations are by no means prohibited or discouraged. In general, we look for research thematically that is patient-centered, which means that the investigators do need to demonstrate that their research question and outcomes are important to patients, caregivers, or other stakeholders, or better yet, have been formulated with input from such individuals. We're looking for studies that are in some way comparative. So, for example, comparing two or more interventions that are currently in use. Of course, scientific rigor is important. We also look for potential to be immediately impactful, meaning high potential for clinical uptake in the near future, not in the longer-term timeline. We also look for research that address conditions of significant burden within the United States that involve patients with chronic or multiple chronic conditions, as those tend to be quite burdensome. Cross-cutting research that impacts individuals with a variety of different conditions, And finally, we do encourage applications concerning rare and understudied conditions. So before we move on, are there any questions? And Erin, I will rely on you if you would to relay questions to me.
Absolutely. There are none in the chat, but just a reminder to folks, as you entered the call, you were muted. So if you do have questions, please unmute or place them in the chat.
Great. Well, hearing none, we can go ahead and move on to zooming in a little closer on our research focus. So what we do fund and what we do not fund. PCORI's funding decisions are in general guided by our strategic plan. And at the core of the strategic plan are the national priorities for health that you see up there on the right-hand side of the slide. And each one of those priorities is reflected and called out through various funding opportunities. We call them PCORI funding announcements or PFAs within PCORI. And to be competitive, applicants should identify which priority has the greatest relevance to their particular research, as this will dictate which funding opportunity or PFA they would apply under. So we would encourage you to go to our website. There's a link up there on the slide and read about our national priorities to better understand how your research aligns with one or more of them. And in practice, these priorities are fairly broad. So the challenge, if any, of the applicant would be just clearly articulating how their research aligns with one of them. Now, before diving into that in greater detail, I'll do this a little bit in a reverse order and first go over what we do not fund, because that is important. So we, in general, do not fund research whose findings will include development of clinical practice guidelines. If that is your main goal, it would be not responsive. But of course, new findings in good science may eventually inform guidelines, and that is permissible. We do not fund research that concerns itself with payment or policy or coverage recommendations. And we do not fund basic science such as study of biological mechanisms, natural history of any disease or condition, pharmacodynamics. And we do not fund studies that establish efficacy for new clinical strategies, meaning that whatever comparators you are including must have proven efficacy or at least be in widespread and common use. Note that PCORI will fund studies that explore the burden of cost on patients, and I will come back to that a little later because it is worth spending a little bit of time on cost and how cost and cost outcomes factor into PCORI-funded research. As you saw earlier, the bulk of our funding commitment goes to comparative clinical effectiveness research, or CER, so we'll spend a little bit of time discussing what that is and what we look for in such studies. CER includes studies that compare health outcomes and the clinical effectiveness, risks, and benefits of two or more approaches to healthcare. And as I was mentioning before, such comparators and approaches must establish efficacy and common use. So it would not work to compare something like usual care to something that is novel and brand new. Usual care comparisons are absolutely permitted, but then the comparator, the other comparator that is not usual care, would have to have some demonstrated efficacy or be in common use as well. So when submitting an application or letter of intent, applicants should explain how their research is comparative, name and describe the comparators and provide evidence of their efficacy and or common use, and describe why this comparison is important to decision makers, which could be patients, could be clinicians, could be other stakeholders. We encourage but not limit focus to high priority, high burden, high prevalence conditions. We're looking for studies that address conditions that place a heavy burden on individuals, families, and society. And that does include rare diseases, which are quite difficult to study. We encourage, but again not limit to, focus on populations historically underrepresented in clinical research, which does include children and adolescents. Our pediatric portfolio is not extensive, but it does exist. And the fact that it is not extensive is an artifact of interest rather than interest from the applicants, rather than any kind of PCORI directive or limit. Now, we place a lot of emphasis on patient-centeredness and patient engagement. What do we mean by that? As far as patient-centeredness goes, we look for research that aims to answer questions that are important to patients within their particular set of characteristics and preferences. And in general, research questions and outcomes both should reflect what is important to patients and caregivers, and better yet, should be formulated with some input from stakeholders who could be patients, caregivers, advocates, any other number of stakeholders that reflects the healthcare community in the broader sense. As far as engagement goes, we place a lot of value on projects where patients are partners, not just subjects. That there is a meaningful engagement and collaboration between the researchers and the patients. And that community, patient, and caregiver involvement is already in existence at the time of application, or at the very least is there in a well thought out, carefully laid out. There is a continuum of engagement practices, from input and consultation to actual shared leadership. And there are projects in the PCORI portfolio that involve stakeholders and patients at all of these levels, including co-PIs. You will choose the level that you feel is most appropriate for your initiative, but PCORI encourages the greatest extent of patient engagement. And now we come back to cost. So as we alluded to earlier, PCORI's legislation directs PCORI to capture, as appropriate, the full range of outcomes data in the course of our studies, and that does include cost and economic burdens. We are absolutely prohibited from developing quality measures and conducting formal cost-effectiveness analysis. So any endpoint that involves either of those things would be immediately considered unresponsive. Things that are allowed in terms of capturing economic burdens and cost outcomes would be data collection on cost burdens and outcomes associated with interventions or outcomes that are in near or longer term. So data collection is allowed and is responsive. Non-responsive and not allowed would be conducting a formal cost-effectiveness analysis of alternative approaches, directly comparing costs between two or more alternative approaches, or modeling in such a way that would enable such direct comparison. Moreover, any proposed research that includes economic impacts as a primary outcome would not be responsive. So you would be looking at secondary or tertiary outcomes. Your primary outcomes should be more patient-centered, more directly patient-centered than that. We would encourage you to review the FAQs related to cost and cost effectiveness that we have on our website if you are at all considering collecting cost data. And I will pause for questions here before we move on to the next section.
We don't have any questions in the chat. Does anyone have any questions? Reminder to unmute yourself.
Right. So then let's dive into the process of application and review. So firstly, who can apply? Any private or public sector organization, academic or non-academic, public or private. Foreign organizations and non-domestic components of U.S. organizations are not prohibited from applying, but they must demonstrate clear benefit of their research to U.S. healthcare system in particular. and individuals may not apply. PCORI offers a number of funding opportunities, funding announcements. We call them PFAs for short. That's how I will refer to them for this slide and for this presentation. Going through each and every single one of them is beyond the scope of this presentation. There's quite a number of them. You saw the value of our funding commitment. It's spread across a number of funding announcements. So I would encourage you to visit our website and read about these funding opportunities. Some of them are issued on a standing basis. So there are some very old funding announcements that have been in play for 5 to 10 years, or unlikely to go away. And recently we've begun issuing funding announcements that are there in place for the entire calendar year. So for the rest of 2023, you more or less have our roadmap already, and you probably would have had it towards the end of 2022 as well, to allow yourself to plan ahead in terms of applying. Examples of proposals we have funded under each PFA are also available on the PCORI website, and this might be helpful to explore if you're not sure which funding announcement is the best fit for your particular project. Funding amounts and period of performance varies by PFA. Our largest PFA offers up to 20 million in direct costs and 6.5 years of performance period. Each PFA has its own town hall, its own dedicated presentation. They are about an hour to an hour and a half. And we highly encourage applicants to attend before they apply, because that is an opportunity to ask questions relevant to that particular PFA. If after reviewing our website, maybe attending a couple of town halls, you're still unsure which PFA might be the best fit for you, you are absolutely welcome to contact us. sciencequestions@pcori.org is a great email address. We do have a policy of responding within 3 business days, so don't worry, your inquiry will not just sit there. And our staff is happy to provide high-level feedback regarding fit for PCORI in general or a specific PFA in particular. Please note that PCORI does not preview proposals like that. So if you email us with a text of your application or letter of intent and ask, is this a good fit? We will simply be unable to answer such a question for you. But as I said, we are happy to have our staff schedule a brief phone call with you to discuss your idea if that would be helpful to you. Our application process begins with a letter of intent. This is a short 2 to 5 pages document that provides a condensed overview of your proposal. Each PFA will have its own specific requirements for an LOI, but in general, LOIs should articulate what it is that you propose to do, and that includes specifics such as setting, sample size, power, calculations, that kind of stuff, how and where you will do it, and why this question is important, why this is important to do. You, of course, must adhere to page limits and other requirements such as project duration and funding cost caps. And there are a few bullet points of guidance up there on this slide. I will point out that multiple LOIs from the same PI are acceptable, provided each is scientifically distinct. If you submit more than one LOI and they are judged to exhibit scientific overlap, we will contact you and request that you choose one that you want to keep, and the others will be withdrawn. And the restriction does apply to single and dual PI submissions. And finally, only the LOIs that are deemed most responsive programmatically and administratively will be invited to submit a full application. So LOIs will be reviewed individually, and as I mentioned, some will be invited to submit an application and some will not. but all LOIs will receive feedback. If not invited, the feedback will help elucidate the reasons why, and if invited, the feedback will contain suggestions on what would strengthen the full application. PCORI does not release statistics such as what percents of LOI are invited for a full submission. Requested funding amount also does not influence acceptance as long as it's within PFA limits. So we occasionally get a question such as, if I submit a low cost proposal, is that more likely to be funded? The answer is no. Full applications can contain some changes from letter of intent. Some changes do require prior PCORI approval, such as principal investigator, awardee institution, and the major features of the proposal, such as aims, study design, and comparators. You are able to secure such approval by emailing PCORI in advance and providing a rationale for such changes, if any. And changes to budget are allowable within the PFA limit and do not require prior PCORI approval, so that can save you a bit of time just rearranging the budget internally. In general, as far as the application guidance goes, of course we request applicants to adhere to all instructions. We advise applicants to start and submit the application early, particularly because your institution's administrative official must approve the submission. That is the final step in the submission. So if you're working right up until the deadline, your AO may be out of office and simply unable to approve your submission, which would be quite unfortunate. We do encourage applicants to review the template, the application template, very early to understand the requirements, because this is where all the letters of support, detailed budget, outline of project milestones, any kind of collaborative leadership plans, if that applies to you, that is generally required at this stage. So these applications are 100+ pages long. Typically, it is quite an undertaking to put one together. So we do recommend reviewing that template early. It's not a bad idea to look at it before you even apply, before you even submit letter of intent, just to know what you're in for. And of course, complete the application on or before the due date. In very, very, very extenuating circumstances, such as there is a hurricane in your area and, half the eastern seaboard lost power, we will entertain delays, but it would really have to be something extraordinary. A few words about our review process once the letters of intent come in. Letters of intent are evaluated internally by PCORI staff for responsiveness to the funding announcement and administrative compliance. And this is a question of fit, not merit at this stage. So we look at adherence to project duration caps, to budget caps, to some of those things that I mentioned earlier in terms of what we do and do not fund. So step one is just a screening rather than a merit review. And as I've already said, a number of letters of intent will be invited to submit a full application. For full applications, PCORI assembles an external panel of experts in a particular field who conduct first a preliminary review. That's step 2, preliminary review. They conduct a preliminary review and assign a score to each application. Based on that score, a number of applications will advance to the next stage. The applications that do not advance will receive the written review or critique, which hopefully serve to explain why the application did not advance, as well as provide guidance to iron out any kinks in the resubmission should you choose to resubmit. Following that preliminary application review, a subset of applications will move forward. And again, we do not release statistics as to what percentage of application typically moves forward at this stage. And the applications that do move forward are scored by a full panel, an even broader panel of merit reviewers at an in-person meeting. Once again, scores are assigned and substantive written critiques are given, and a subset of applications is put forward for further consideration. The identities of our reviewers are private, and these are closed meetings, so applicants may not attend. But as I mentioned, substantive critiques will be made available to the applicants. Finally, based on this multi-step external expert merit review, PCORI staff recommends applications for funding to our selection committee, which again consists of external experts and members of PCORI's Board of Governors. And following that, our executive director holds the final approval of all funding slates, at which point formal notifications go out regarding whether or not you've been funded. This process is rather lengthy, I will warn you. This entire process, this multi-step merit review process, does occur over several months. So it may be some time between when you submit a letter of intent, then submit your full applications, to when you hear back about whether or not you've been funded. And that is a policy of PCORI, and unfortunately, prior to that final step, our executive director approval, we are unable to communicate with applicants as to whether or not their application is being considered for funding. Something for you to be aware of, especially if you're considering submitting similar research to multiple funding agencies. In general, what is expected of PCORI reviewer? So of the people that are reviewing the applications. Our reviewers include scientists, of course, but also patients and other stakeholders. And as I mentioned, the identities of reviewers remain private. Of course, all reviewers are required to understand and apply PCORI's mission and vision, and bring expertise and perspective that enhances the quality of review, hence a broad panel including scientists, patients, and other stakeholders. Patients and other stakeholders are required to have the ability to represent perspective of broad or specific stakeholder groups. So they're chosen for their expertise and their involvement in the patient community. And scientists and panel chairs are required to have an advanced degree in a related field, having published peer-reviewed publications, and have received current or recent funding in a relevant field of study. This is our merit review criteria, which our reviewers will use to evaluate each application that comes. So potential for the study to fill critical gaps in evidence. This is often illustrated via systematic reviews, clearly pointing out that there is a gap. And the studies, of course, should address a clinical uncertainty or decisional dilemma experienced by patients and other stakeholders. As I mentioned before, potential for study findings to be adopted into clinical practice and improve delivery of care. This is that earlier point about potential for uptake within a shorter time frame rather than longer. Of course, scientific merit. Our reviewers also look at investigators and environment, so looking to answer whether this project has the appropriate setting and expertise and qualifications and experience to carry out the research as written. And of course, is there sufficient capacity and support from facilities and equipment? This is where your letters of support will come in. We evaluate patient-centeredness. So has the investigator clearly articulated that what they're proposing is important to patients and stakeholders? And we do look at patient and stakeholder engagement. At what points in the development of the research proposal are patients and stakeholders engaged? To what extent are they engaged? Are they engaged in some kind of a leadership capacity, or is this just a brief cursory consultation? We also look at all of that together with our external reviewers. Scientists and non-scientist reviewers are asked to speak to different aspects of an application. As you see up there, scientist reviewers are requested to provide review feedback and scores across all of the criteria, and patients and other stakeholders are exempted from reviewing criterion 1 and 3, which tend to be more technical and require more focused clinical expertise in the field. Nevertheless, perspectives of reviewers are weighed equally, and they all assign a score, which is again weighed equally across patients and stakeholders as well as scientists. So that is an overview of our application and review process. And once again, I will pause for questions.
There are no questions in the chat. Do we have any questions from the group?
Hi, Erin. I do actually.
Go ahead.
This is Mina. Thank you so much. This is really helpful. I don't have any experience with PCORI. I'm familiar with the NIH, so this is very helpful for me. Do you have like any maybe approximate like timeline of how long it takes? Because I know if it takes several months, but when one submits the letter of intent till they hear back, is it like 3 months, 4 months, up to a year?
You know, to be honest, and I appreciate the magnitude of this figure, you're looking at more like 6.
Oh, I see.
We do appreciate that this is quite the long process, and it really does have to do with the fact that assembling the required expertise for this multi-step review process is quite the undertaking. We have an entire merit review department dedicated to that. So I have a lot of sympathy for planning your research that far in advance. And of course, we do what we can to expedite this as much as possible. Unfortunately, that is the length that you are looking at.
I see. And you mentioned that it should be something that engages patients. And typically in studies that I work on, I look at retrospective data, it's like larger scale data. But that's why, like, when I think about PCORI, what comes to my mind is something that, like, for example, interviewing patients, like engaging in the process somehow. Like, do we have to engage patients before? And we basically say we engage patients, we hear from them, and like this issue is important to them, or can it be something that's done afterwards, or like in the middle of project? Like, at what stage do you expect the researchers to explain that they engage patients?
That should come in with the letter of intent. Now, by the time you submit the letter of intent, you're not required to conduct your patient engagement. But you should discuss your plans for patient engagement very, very early on. Letters of intent, we do pay attention to any plans for engagement. So it is permissible to engage patients early on to understand what outcomes would be most important to them, to refine your outcomes or include some patient-centered outcomes, and to have a plan to engage patients later on in the process.
Okay.
Does that
last
help?
question. Yes, last question. This letter of intent is very interesting to me because I don't have submitted it, and it was very brief to other institutes, or to NIH. I submitted a grant, and there was no letter of intent. To me, what you explained seems like a mini proposal. Is it like that, like with the specific aims and maybe some budget information? Is it like that? Are there examples on your website?
It is essentially what you say it is. It's a very condensed overview of your planned research that would fit into 2 to the maximum of 5 pages. So you don't have to have your budget hammered out, but you should be able to say, we are requesting approximately this many dollars. And your specific aims should be written out. The more specifically, the better. I believe our letter of intent template literally includes space for aim 1, aim 2, aim 3. So it should be stated, with that level of clarity. And of course, there should be, a list of references and citations. But there's no need for an appendix. There's no need for letters of support. You don't need to have secured that level of collaboration by the time you submit the letter of intent. But it's to save our applicants the trouble of putting together this gigantic application package that is 100+ pages long to have that initial mini overview of your proposal so we can immediately say, yes, this is great, or, please come back later with the following changes.
Yes, thank you.
Thank you for your questions, Mina. Do we have other questions?
All right, hearing none, I will spend just a little bit of time on this section. Here are some opportunities to engage with PCORI aside from directly applying for funding. There are ambassador programs, advisory panel, and merit reviewers. So the merit review process that I just described, you can be on the other side of that table. You can be one of the merit reviewers. If that is of interest to you, please have a look at our website. There is an outline of all of these opportunities and how to go about actually practically engaging in them. And we welcome your involvement at all of these levels. We have some resources to support multi-stakeholder research teams. We have some resources to support engagement. And we have some general contact information. As I said, our policy for responding to general emails such as info@pcori.org is within about 3 business days, so you can expect a pretty quick response. It is also completely permissible to request a phone consultation, even if you are in pretty early stages of developing your idea. And of course, we have social media. I will note that the best way to get in touch with us is through email. We do have a phone number up there, but we will likely, if you call us and if you call that number and you speak to someone on the phone, they will likely direct you to email info@pcori.org anyway. We are pretty big on record keeping, and we do like that kind of written record that is afforded by emails. So don't be shy. Feel free to email us. And this is the end of my prepared presentation, and I know we still have some time, and I welcome any and all questions.
Thank you so much, Natalia. There's no questions in the chat, but I would definitely love to open up to the group, so please feel free to unmute yourself and use this time to ask any questions you may have.
Hey, this is Rob Akins. Thanks, Natalia. Thanks so much for your presentation. It's very helpful. I have a kind of a one-off question maybe. In our chat, someone identified themselves as a PCORI ambassador.
Oh,
Who's
wonderful.
in the meeting here today. So it's Richard James. So could you explain the role of, or maybe Richard could, the role of PCORI ambassadors and how we might be able to interact with him as opposed to aspects of the program?
Well, I think I'd like to turn the microphone over to Richard, if you would.
Are you still
Thanks,
on, Richard?
Natalia.
There you
Yes,
go.
I'm here. Yeah, so I have been the PCORI ambassador for about 4 or 5 years now. Prior to when I was an associate with Nemours, I have a long history in Delaware with congenital heart disease advocacy, and have worked with a number of groups and have sort of stood up a number of groups, including Mended Little Hearts and Conquering CHD, which another member of the call is a member of. The role of the PCORI ambassador is to just sort of be a promotional voice, sort of encourage, PCORI's activities in the state, to promote initiatives, and be a person who investigators can approach to be a liaison between their work and PCORI, and just generally assist with things, and to be kind of in some cases help recruit patient partners, be a patient partner, contribute to sort of the creation of grants and applications. Thanks for the time. Thanks, Natalia.
And thank you, Richard, for your valuable work.
Do we have any other questions or comments?
I mean, I have questions I can ask.
Go ahead, Mina. Now's the time.
So do you allow for no-cost extensions?
We do.
Great. And this merit reviewer program, so is it like what aspects of, because I think it would be helpful for somebody like me with no experience with PCORI, maybe if I could attend, some of the review sessions and see how it works, like before I submit something. But is it like, would reviewers with no experience be allowed to look at the scientific aspect of the proposal, or those are just like experienced reviewers who have experience with PCORI?
I'll first mention that our merit review meetings are closed, so unfortunately, it's only the current reviewers and PCORI staff that would be invited to attend. In terms of how we make the distinction between scientific and non-scientific reviewers, which I think may be what you're asking, so experience with PCORI specifically is not a requirement. In order to be considered a scientific reviewer, we ask folks to demonstrate sufficient expertise in their field, which would be evidence, through an advanced degree, peer-reviewed publications, and funding received in that specific area. However, there's also the categories of patient and stakeholder reviewers, and for that, there is no requirement such as an advanced degree or funding in this, in any particular area. And if you are interested in either one of those opportunities, I would absolutely encourage you to check out our merit review program, which more specifically lists how you can actually become a reviewer.
Great. Thank you.
And I could chime in there again for a moment, Natalia. It does, in PCORI, there is a much greater weight given to the plain language kind of proposal, which is what the lay stakeholders review. I've done a little bit of that. I've worked in a couple of organizations doing grant review on the plain language side, and, there's always scope for improvement. My feeling is that PCORI gives a greater weight to the dissemination plans, to the plain language summaries, to the material that's kind of public facing and needs probably more attention than people have been sort of formally used to giving it.
Thank you. And last question. So when NIH, what I'm used to is that like typically we contact program officers, but with the email that you mentioned, if we send an email and send maybe like the specific aims, would somebody get back to us and then we can have a call, right? Is that correct?
That is correct, and you will typically be speaking to a PCORI program officer as well.
Oh, okay. But we reach out to that email, like I don't reach out to program officers directly.
Right. We do discourage reaching out to individual folks. What happens is that email address is sort of a catch-all bucket for inquiries, which then get triaged by our staff to appropriate individuals. And then you would hear back from that particular individual.
Great. Much easier. Thank you.
Mm-hmm.
Any additional questions from the group? All right. Well, thank you so much, Natalia, for your time. For folks who are able to join the call, just so you're aware, it is recorded, so we can share that with you, and then you can also share that with your colleagues. We'll get that out to folks this week, most likely next week. But other than that, thank you so much, Natalia, for your time, and we really appreciate the opportunity to learn more about PCORI.
It's my pleasure. Thank you all for being here.
Take care,
Thank
everybody.
you.
Have a good weekend.
Have a good weekend.
Thanks.
Bye.